It is now 50 days since the first case of coronavirus was announced in Kenya, pushing the country into uncharted waters of health emergency. And for early detection and proper control of the spread, the government is working with a target of 250,000 tests for the virus, with all indications now suggesting it could spectacularly miss that target unless drastic changes are made to the testing regime. Gituku looks at the mass testing journey that has failed to take off despite repeated promises by government officials.
The Ministry of Health adopted the global mantra of test, isolate, treat and trace in a bid to boost its war against the new coronavirus. While the country's battle has been multifaceted to include preventive measures, testing and test results have all along defined where the government takes its focus next. As such, testing has the likelihood of being the strongest or weakest link in the battle. In its planning, the Ministry of Health has devised its intervention around 50,000 expected coronavirus cases, with 1,000 of them sliding to critical care. The intervention is designed for an initial 6 months based on documents tabled before Parliament. In his presentation before the National Assembly, Cabinet Secretary Mutahi Kagwe explained that the country has sufficient personnel protective equipment to last the country 6 months, while also indicating necessity to consider counter needs. The Council of Governors has since reported securing 5 billion shillings to be released upon passage of the supplementary budget currently before Parliament. And so on paper, the country appears prepared to deal with the coronavirus.
Our plan is to conduct 250,000 tests by the end of June. However, this 250,000 will not match our population. Hence, we are collaborating with our development partners to ramp up our surveillance testing mechanisms.
So far, however, the country has only tested 20,268 samples in a span of 49 days of the virus. To meet the target of 250,000, a balance of 229,000 remains. But it's only 61 days to the end of June, meaning on average 3,766 tests would need to be conducted daily to meet the target. Over the past 50 days, 413 people have been tested on average, some days recording up to 1,000 samples.
This could have skewed our figures because you remember there's a certain time we were able to test as high as 1,500. Then we went down to the 300s, now we are back to the 700.
A report of the Senate Ad Hoc Committee on Coronavirus indicates that the Ministry of Health admitted to have installed capacity to test of up to 37,000 samples every day. But only 1,000 or less is being used. The Senate committee reporting that some of the challenges include inadequate skilled personnel to collect samples and run the tests, that testing kits and necessary reagents and consumables are in short supply. The Senate committee finding that some of the kits donated to the government are faulty. As such, the Kenya Medical Research Institute that had been announced would be ready to manufacture testing kits locally is facing financial crisis. Kemri needs up to 790 million shillings. Of this, 100 million shillings is needed to hire personnel, 540 million shillings as financial support, since Kemri has exhausted its reagents and materials for testing or screening for the virus. Kemri needs 150 million shillings for equipment. In the meantime, the Ministry of Health has accounted for an initial 1.3 billion shillings from the World Bank, part of which has been spent or allocated on non-essential expenditure.
Our accounting team, together with our international partners, will issue a detailed report soon. Even as we speak, the accounting officer has prepared a statement on this matter, which will be shared with you very soon, possibly as early as tomorrow.
Majority of counties have no capacity to test, many of them having to deliver their samples to Nairobi. Gituku, TV.